Let's talk about something many women silently struggle with. That's irregular menstruation. Some of us see our period this month and the next it disappears. Sometimes it comes too early, sometimes too late, or even stays longer than normal. It can be confusing. Yes, it can be confusing, frustrating, and even scary, especially when you don't really understand what's happening inside your body. I've seen many women go through this. Some worry if they are pregnant, some fear they are sick, and others just stay confused. But today, I want us to talk heart to heart about what irregular menstruation really means, what causes it, and what you can do about it. So sit with me, let's learn, and let's heal together. A woman's menstrual cycle comes every 21 to 35 days and it lasts 2 to 7 days. But when your cycle suddenly becomes shorter or longer than usual, you skip months entirely, that's what we call irregular menstruation. Sometimes your flow changes, maybe very heavy on 1 month and extremely light the next. It can also come with cramps, tiredness, or usual discharge. And when this happens often, it's a sign your body is trying to tell you something. Let me tell you some causes of this irregular menstruation. Let's talk about it. Okay, these causes can be common because knowing the cause helps you to take these right steps. One of the causes is hormonal imbalance. Your hormones, especially estrogen and progesterone, these two things, hormones control your period. When they go off balance, maybe because of stress, poor sleep, or diet, your cycle can easily change. Stress and lifestyle can also cause it. When your mind is troubled or you are going through a lot, that's emotional stress, overworking, or even lack of stress, it can affect your hormones. I always say this, your body listens to your mind. If you are constantly anxious or not resting well, your period may delay or come regularly. Another thing that can cause it is weight changes. Gaining too much weight or losing weight too fast can also affect your hormones. Your body needs a certain fat level to produce reproductive hormones properly. And also, we have this infection. Infection is one of the things that I really want to emphasize. Infections can cause irregular menstruation. Pelvic infections, untreated STIs, or even vaginal infections can disturb the uterus and ovaries. When that happens, your period may come too early, delay, or become very painful. Some women ignore infections or treat themselves with random drugs. Please don't. If you notice unusual discharge, smell, or pain during sex or urination, see a health professional. It's better to treat it early than allow it to affect your womb or fertility later. Another thing is what birth control or medication. Sometimes pills, injections, or even emergency contraceptions can cause your period to delay or skip for a while. Your body may be just adjusting the hormones, but if it continues, it's best to check it with your doctor. Now let's talk about ovulation because many women trying to conceive worry about this. When your period is irregular, your ovulation becomes unpredictable. You may not know when your fertile window is, meaning it's harder to plan or even track pregnancy. In some cases, your body might not release an egg at all. That's why I always advise, if your period has been irregular for months, don't just wait it out. Go for a proper checkup, do hormonal tests, and if infection is involved, treat it completely. Sometimes, once you treat the underlying cause, your cycle returns to normal on its own. Now, let's talk about when to see a doctor. Please don't ignore all these things I want to mention. If you are noticing it, please go and see your doctor. When you have missed your period for more than 3 months and you are not pregnant, when your bleeding is too heavy or lasts more than 7 days, when you experience severe pain or foul discharge. Now, you notice bleeding in between your periods. All these things are red flags. Your period is wise when something changes suddenly. It's sending a message. So listen to it. Every woman listening to me right now, please don't feel ashamed or afraid. You are not alone in this. Irregular menstruation doesn't make you less of a woman, and it doesn't always mean something is terribly wrong. Sometimes your body just needs attention, your body just needs rest and care. Just eat healthy, drink water, manage stress, avoid self-medication, please, and most importantly, love your body. It's your first home. If you found this video helpful, don't forget to like, share, and subscribe because we are going to keep talking about real women's health issues right here. Thank you for watching and take care of yourself always. Bye.